Dear colleagues, with pleasure I want to invite you in first World Online Congress. My name is Yana Yutskovskaya. I am from Moscow. I have practiced more than 25 years in cosmetology and dermatology clinics. I am an owner of the clinics in Moscow, Vladivostok and Sochi. We did a lot of research and we did a lot of published of our research and the result of our practice. With best pleasure I want to show you my practice in my clinic and practice of my doctors. With pleasure to you, and start. I prepare two master classes. First class will be focused on the treatment of patient neck which I use in my day-to-day practice. Typically, these patients have such compliance as a noticeable platysma bands, returning wrinkles, and skin laxity of the neck. So, in this case, I propose to apply several treatment techniques. They are combined in one session, and I have been using this combination approach for more than 5 years without any complications. Before the procedure, we apply a topical anesthesia for 40 minutes. It is the amla cream with covered by a plastic film to achieving a closing effect. The treatment starts with bilateral soft injection by the blanching technique. The required amount of the product is 1.5 cc and I use a 32G and 30G needle, depending on injection technique. In this case, the needle is 30G and 13 and it will be retrograde line technique and blanching technique. This technique assumes that hyaluronic acid is injected in papillary dermis. We should see the steel needle during its inserting into the skin. The product is injected in tiny amount of average of 0.01 milliliters and the depth of injection is the K issue. The technique consists of multiple injections. As a result, the patient would have some post-treatment petechia. The second step of the treatment comprises botulotoxin injection. In my practice, I choose inca-botulotoxin. In addition to the neck, the injections are extended to the platysma muscle fibers, rushing across the mandibular lines. For the reconstitution of 100 units, I add 1 milliliter of saline solution. For Nefertiti lift, 16 units for the toxin per site are required. 4 units for injection site and a total amount of 32 units. The injections are made superficial and into the platysma muscle fibers. Then we inject the neck along the platysma bands. The distance between the injections sites is approximately 1 cm. On average, 2 units per injection site are recommended. The total amount of the three product for the neck treatment is 40 units. The third step is to place radius 1.5 cc in hyperdilution. For the neck skin, the recommended dilution is 1 to 2 and sometimes I add lidocaine 1.5 cc of lidocaine in such case. Thus, radius 1.5 cc was diluted with 3 milliliters of the saline solution, and we received 4.5 cc of the diluted product. Since topical anesthesia was administered to this patient, I did not add lidocaine to the syringe. Injections can be made both with a needle or cannula. The needle is 27G19 and cannula is 2270. It is critical to make injection in a subcutaneous plane, mainly over the entire treated area, and the distance between the injection sites should be about 1 cm. After product placement, some lumps cold occur, and molding is easy performed to smooth of skin surface, because the product was diluted in injection as a solution. At the same time, the product should be not visible through the skin. It is extremely important consideration for avoiding complications. When needle is used, we perform multiple injections and the skin will need more than recovered. If cannula is used, only one entry point is made, and the product is injections in fanning technique. It is advisable to spread the product as uniformly as possible. After the procedure, I apply a post-treatment mask and invite the patient to my office for a follow-up visit after 2 weeks. The second patient treatment of the skin aging sites on décolletage area. You can see photoaging since elastosis. I recommended 2 procedures to such patient. Blanching technique to decrease the returning wrinkles in the décolletage area, call them sleep creases. To the first step is to inject Belaterasoft blanching technique. I use 32G needle and inject in the papillary dermis. In this area, the blanching effect is over missing, and therefore it is essential to inject the product in a particular plane, the papillary dermis, and not to make papules. We should perform a very accurate needlework in the skin of décolletage area. The second step for this patient will include placement of radius in hyperdilution, radius in inquire product with the proved stimulation of the production of the high-quality elastin. Radius amount 1.5 cc and we dilute. It is in follow away 1 part of radius and 2 parts of saline solution. Finally, we have received 4.5 cc of the diluted product in the form of solution. To perform the procedure, I used 27G90 needle and inject the product as a retrograde line technique along Langer's lines. The injections are made at the subdermal plane and the injection sites are approximately 1 cm apart. It is more difficult to make injections with a blunt cannula because the patient has elastosis. In this situation, I usually prefer to work with a needle.